In its first update since 2016, on January 22nd, 2025, the American Society of Clinical Oncology put out their new update for the guidelines on neoadjuvant chemotherapy for newly diagnosed advanced ovarian cancer, an ASCO guideline update. Now, this guideline does provide recommendations for patients with stage 3 and stage 4 epithelial ovarian, fallopian tube, and primary peritoneal cancer, or EOC, with recommendations for the use of neoadjuvant chemotherapy and interval cytoreduction versus primary cytoreduction and chemotherapy. There were some big key changes that we saw in the initial assessment, the selection criteria, and preferred chemotherapy regimen sections, but we do want to point out that one of the big recommendations we saw is that proper diagnosis does require histological confirmation, and it's strongly recommended that a core biopsy be used, as it's much better than when compared with cytology alone. Now, in cases where a core biopsy cannot be performed for diagnosis, cytology combined with CA-125 and CEA levels are acceptable to exclude non-gynecological cancers. Make sure to check out this full guideline and all of the new updated recommendations. There's a link to it on our website.